There you go, choose that. Okay,
Wait, mine
choose
doesn't
that,
work.
okay.
Can I turn it up right or no?
Yep, it's
You better get a good one.
All right, I'm getting
closer. Alright.
By the time you start it,
no, do it that way, do it that way, do it that way, yeah. Thanks.
We got it. You can put your hand in front of the lens.
Yep, there you go. You got it, right?
Right, the camera's up in the corner, so watch your fingers.
There you go, just like that, just like that.
So let's get the model up. So we'll start with the nasal
what?
cavity, the entrance to the respiratory system. You have the hole in the nose called the external nair, or the nostril, right? Right, just inside there where all your mucus collects there and forms pores. That's the vestibule. Then you enter the nasal cavity proper here, where you have a series of ridges and grooves called nasal conch and meatus, right? You have a superior, middle, and inferior conch, and superior, middle, and inferior meatus, also referred to as the nasal turbinates, because they cause the air to flow turbulently there, right? Then at the back of the nasal cavity, you have the internal nares, which leads to the nasopharynx, which is right behind the nasal cavity in the beginning of the pharynx. Then as you progress inferiorly, you come to the oropharynx behind the oral cavity. That's the uvula right there. You have the nasopharyngeal tonsil. You have the palatine tonsil there and the lingual tonsil at the base of the tongue. When you get to the level of the upright epiglottis, now you've entered the laryngopharynx, right? That's the epiglottis right there that closes over the opening in the airway when you're swallowing food or water, so it doesn't go into your airway, right? Then you enter the larynx proper, or your voice box. You have a pair of folded pieces of connective tissue. You have a vestibular fold and a true vocal fold. So the upper is the false vocal cord, the lower is the true vocal cord. The large model larynx is nice, so you can see all the different types of cartilage that make up the larynx. Here's your hyoid bone for reference. This large kind of shield-shaped cartilage, which is not completely enclosing, just the lateral anterior sides, is called the thyroid cartilage. It has a prominent projection in the front called the laryngeal prominence, or the Adam's apple on the male, right? Posteriorly, you can see another series of cartilages. The lower cartilage here, which is a complete ring of cartilage around the top of the trachea, is called the sigmoid cartilage. And then you have what are called the arytenoid cartilages, which are articulated with the sigmoid cartilage. And then the horn here, the tip, is called the corniculate. Right? Now the vocal cords are attached to the arytenoid cartilage posteriorly and the laryngeal prominence anteriorly, and then there's a little muscle here that pulls on the arytenoid cartilages and kind of pulls back on them, puts tension on the vocal cords to change the pitch of your voice. Looking inside the trachea and the larynx, you can see that there's this epiglottis here which covers over the opening between the vocal cords. The opening is called the glottis. Okay? Now you come to the trachea proper. The trachea, remember, is made out of C-shaped rings of cartilage. The back of the trachea is a soft tissue called the trachealis muscle. In between the tracheal cartilages are little pieces of connective tissue called the annular ligaments. Okay? So the kind of nice grayish tissue is cartilage, the little striated whitish tissue is the ligaments. The trachea enters then the mediastinum of the chest, and it is eventually split into a left and right primary bronchus by the last cartilage of the trachea called the carina. Right? And then you have a primary bronchus for the left lung, a primary bronchus for the right lung, secondary bronchi, and tertiary bronchi. This model has only gross anatomical structures: primary, secondary, and tertiary. Don't tell me these are bronchioles. Okay. We also have kind of a large model that displays most of that gross anatomy. Right? It also shows you the gross anatomy of the lungs themselves. Over here on the left, you notice that the left lung has an upper and a lower lobe separated by a oblique fissure. It also has a little space here missing where the heart sits, so it's called the cardiac notch. Right? Now the right lung, which they don't show on this model, actually has three lobes, three macroscopic divisions. Sorry about that. You have an upper, a middle, and an inferior lobe separated by a horizontal and an oblique fissure. Each of the lungs has a medial concave surface called the hilus. Within the hilus, you'll find a series of structures that anchors each lung to the pulmonary circulation, as well as the bronchial tree called the root, which includes the primary bronchus, the pulmonary arteries, and veins. That's called the root in the hilus. Okay. Each of these smaller macroscopic subdivisions of the lobes are called lobules. All right, and then you get to microscopic subdivisions. This is a blow-up of a microscopic anatomy of a terminal bronchiole, which then gives rise to respiratory bronchioles, alveolar ducts, and then alveoli, right? A cluster of alveoli is called an alveolar sac, but each individual little gas exchange unit is called an alveolus. Okay. I think that's it.
Thank you very much. Did you miss anything?
No.
Thank
Got
you.
it all.
Kim,
I think I'm gonna get yours. Yours was so much clearer than mine.
Thank you so much.
Yeah, I don't know how to stop it.
Yeah, just.